In this video, I'm going to talk to you about how long you should leave it after voice feminization surgery before having therapy. So, because people have therapy at different times and surgery at different times, and some people have some therapy before and some people don't, everything's all a bit mixed up. It really depends on your individual circumstances. But sometimes people have their voice feminization surgery. Perhaps they had a little bit of therapy that wasn't effective, or they didn't have very much, or they didn't want it. They had their voice feminization surgery, but come about 6 months to a year later, they're a little bit disappointed with the outcome because it hasn't changed very much. That's one of the reasons I always advocate doing a full course of voice feminization therapy before surgery, because it really does set you up in a good way if you have it done in a recognized practice with people who are quite experienced, because just doing a few videos here and there is not really enough. It takes a bit more work than that and a little bit more guidance. But say somebody's had their surgery and a year later they're thinking their voice isn't really where they want it to be. They often say, is it possible to have voice feminization therapy now? Will it make any difference? I always think, yes, it will. And in some ways, having the surgery, at least it will have perhaps made some alteration to the voice, perhaps a little bit of alteration to the pitch, or at least make it easier to maybe raise the pitch a little bit, if that's the reason that they're not happy with their voice. But the real reason that people should have voice feminization therapy is because, as we know, the surgery will only lift the pitch. And very often what I'm working with is things that aren't to do with pitch. It's to do with intonation and delivering the voice in a slightly more different way. Perhaps a more feminine style, so perhaps not having such an abrupt speech pattern, which won't really change with voice feminization surgery. And when I've done that, where people have had their surgery quite a while ago, they do make gains afterwards. So I always think it's worth considering that, and not to worry about the fact that you've had the surgery and it didn't work and that's it, there's nothing else that can be done. In fact, there's nearly always something that can be done with voice if the person's a little bit motivated and they want to get the change, and if they seek the right help. Ideally, people should have some voice rehab after their surgery. So this would be perhaps 2 weeks after your surgery has been done. You have voice rehab. In my program, that's about 4 short sessions just to rehabilitate the voice, not specifically voice feminization, but of course the exercises that we use always lend themselves to that kind of work, just to prepare the voice and to put the voice in a position of being able to go higher more easily and be more flexible. So that's a short program of voice rehab. Any person who has a voice surgery will have some voice therapy rehab afterwards, or is offered it. Whether they have it is another matter, but we always recommend it. And that prevents the voice falling into a bad placement and just maximizes the effect of the surgery. Following that, the person is then able to have some voice feminization therapy if they want to. Some people feel they won't need it, but some people feel they do need it. Some people just leave the voice and see how it goes and then might come back afterwards, 6 months, a year, 2 years. It depends whether the person still wants something more out of their voice. More often than not, they're having an issue with the voice. Perhaps they got misgendered on the telephone, or something happened that made the person think the voice isn't working as well as they want it to. That's what usually drives somebody into therapy that wasn't interested in it before. And it's hard to say whether there's a limit on when you can have some voice feminization therapy after surgery. I tend to think not. I tend to think that obviously it's ideal to do it earlier, but perhaps 2, 3, 4, 5 years down the line, if they feel their voice is suddenly not working in the way that they want it to, then the advice is always to have an assessment with a voice specialist and perhaps do a little bit of therapy with them to help the voice. Some people ask me whether they can do the whole voice feminization course after they've had the voice surgery. Some people think that doing the feminization surgery first is better and then they'll do their voice therapy afterwards. It's not exactly what I recommend. I rather recommend it the other way round. However, it is possible to do that. And sometimes people just feel doing that gives them peace of mind, or it really does help the voice. So it's possible to have a voice feminization full course after surgery as well as before. The ideal best practice then is to have a voice feminization course first. If you're going to go on to have surgery, have the surgery. Have a short little course of voice rehab. They're just those short sessions afterwards to help the voice settle down and help the vocal cord closure start to come back. And then after that, that will probably be enough for most people. By not having the voice rehab afterwards, Very often they do set up a little bit of a legacy for themselves where the voice might be a bit creaky, might not work so well afterwards, or might have missed out on some things that are really helpful to support the pitch and the resonance that the surgery will try to work on, but won't cover everything. It can't really. By following that first way, they will save themselves having to do more therapy afterwards. If it's the case that the surgery has already taken place and some time has elapsed and you're not sure whether any therapy will make any difference whatsoever, do see someone who can give you an opinion and hopefully work towards your voice goals a little bit more. If you found this video helpful, press the like button and subscribe to the channel.